You want healthy, glowing skin, but with all the products, trends, and conflicting advice, it's hard to know what actually works. I understand. I am Dr. Tiina, a former cardiologist and specialist in the skincare development and cosmetic safety expert. I've spent years studying the science of skin. Welcome to Medder Beauty podcast, where we uncover what really matters, break down the science, and give you real expert-backed skincare advice. Whether you're looking to achieve radiant, healthy skin, curious about anti-aging, or want to understand what's really in your product, you are in the right place. Rooted in science and the truth about what your skin actually needs, we'll have in-depth conversations with leading dermatologists, medical experts, and skincare brand founders to bring you the latest innovations, evidence-based insights, and industry secrets that truly make a difference. We are so happy you are here. So let's go. Let's discuss about acne. Acne, it is the most common skin concerns which affects literally everybody. By statistics, about 90% of people living in the Western world, they suffered from acne at some point of their life. It doesn't mean that you suffer from the acne all your life, but they've been weeks or maybe years in your life when you experienced this unfortunate skin inflammation. The understanding of acne and the approach to the acne treatment changed dramatically in the last 15 years. How we've seen acne in the 20th century? First of all, acne was absolutely a skin condition affecting mostly young people, teenagers, mostly young boy and very young men. It's understandable because the role of hormones in the acne now is well studied, but now we discovered that acne changed very much. And we don't see it anymore like a teenager skin condition. It can affect people at all stages of their life. And now, for some reasons, girls, they are suffering from acne even more often than boys. Acne became more prone to become chronic. And also, the story of acne became longer, paradoxically, because we think we have best skincare, we have best pharmaceutical treatment, we have so many breakthroughs in the dermatology, but somehow we have more people suffering from acne, more categories of people suffering from acne. And we see then if before teenagers had been suffering from acne for 3, maybe 5 years when the treatment wasn't very efficient, now we see a lot of people who experienced acne at 12, 13 years old, and it became chronic, and they still experience an acne when they're 22, 25, 30, maybe 40. Different people, they're suffering differently. For example, patients with skin rich in melanin, with darker skin types, like Fitzpatrick type, 5th or 6th, they have more difficult and more resistant form of acne. People with fair skin types, they have milder form of acne. It's not a guarantee, but it is a tendency. And what is also interesting, most severe form of acne persists in the country when traditional acne treatment is still very popular. And also another factor affecting acne severity, it is skin cleansing. In the area when acne traditionally is treated by cleansing, brushing, disinfecting of the skin, we see more of severe form of acne than in the country when people pay less attention to acne. And also another very interesting point, that acne is a Western civilization illness. And it was proven unexpectedly by epidemiologists who worked analyzing different health conditions in different countries over the world. And they found that in some tropical islands, people never heard about an acne, never see it in their life, until the moment when Western civilization came to the island, bringing this Western food and Western hygiene. So, bright side of all of it, probably the acne is avoidable. But being the part of the Western civilization, we bring acne everywhere around you. So let's see what we can do about it. First of all, it's good to understand the causes of acne, but we don't know enough about it. Sometimes we are speaking about acne as a genetic disease, and a lot of people, they feel like acne can be genetically predetermined. It is true at some point because in the family, when mothers and fathers and previous generations, they've been suffering from acne, we see more of acne cases in the next generations. But also, it's not only about genetic, it's also about the food traditions and the lifestyle traditions in the family. However, it was found that few genes are affected and can be slightly changed in people who suffer from chronic severe forms of acne. That's leukocyte genes and cytochrome genes and some others. Also, hormonal level can define the severity of the form of acne and the incidence of the acne in some people. So is your androgen level higher, is the male hormones level higher, the risk of the acne development. But it is not only about it, it is also about your skin sensitivity to the male hormones. Maybe your hormonal level is perfectly healthy, but your skin for some reason can be more sensitive. So if it overreacts to androgens, it can trigger the acne development. And also another thing, it's the hyperreactivity of immune system and nervous system. Acne, it is a psychodermatosis. So it's very much related to the stress level. It's very much related to the mental health. And a lot of people suffering from depression, they're suffering from the acne in the same time. And of course, you can say, yes, acne, it's so unpleasant as a skin condition. It's uncomfortable. It changes the skin appearance. It deforms the face sometimes, especially in the severe cases. So it's logical and people suffer from the depression. But apparently, if the efficient treatment of depression lead to the big improvement in acne as a skin condition without any change in the acne treatment. So it is also something to think about it, because acne, it is not only about the skin. It's about your genetic individuality. It's about your nervous system, your mental health, your immune system, your hormonal level, and about your lifestyle, and about your diet. And once again, there are bright side and dark side of everything. And I understand that when I'm speaking, then acne is much more complicated, and we've seen it previously when we've been speaking about the acne like a skin condition which should be treated only topically. So give me something to apply on the skin and it should clear off my acne. It's not so easy. There are no shortcuts in this treatment, but in the same time, when you see how many factors can trigger the acne and can change the severity of the acne, it gives you the ideas, and you can approach the acne from different sides. You can treat the depression, you can work on your mental health, you can improve your lifestyle, you can improve your diet, you can see what you can do for your hormonal level or for your immune system. And all of this can be very beneficial for your health and for your skin condition. What happens in the skin? When you see an acne, you see a papule or pustule just appearing here on the skin surface. But it is a condition affecting the whole, what we call pilosebaceous unit. So sebum glands, hair follicles, and all the tissue around it. What we see on the skin surface, it's only results of the process happening much deeper. And when comedone starts to form, it starts to form to these sebaceous glands. And the process is very slow. We can slow down this process, we can affect this process in the gland itself, but when comedone is formed, it takes about 8 weeks to get over on the skin surface. You should not expect results very fast, because the comedone is still there. You start to apply products today, but all this 8-week process is still in the skin. If you start to apply some anti-acne skincare routine and you don't see results in the first 3 days, it's perfectly normal because it is not magic. Dermatologists or skin practitioners, they are not fairy godmother, which can just change your skin appearance immediately. It will improve in a couple of weeks, maybe in 3 weeks, it will be less inflamed, it will look better. But to see real change, you need at least 2 months. Being realistic, I will be speaking about the acne treatment taking from 2 until 6 months, and sometimes even longer. So how it works? The sebum glands produce more of sebum. And this sebum changed not only quantitatively, so it's not only too much of sebum, it's also about quality of the sebum. The sebum in acne case contains more of fatty acid, which has these pro-inflammatory properties. It is more viscous, it's less liquid, and it has less of natural antioxidant inside of the sebum. And this sebum became the perfect food for acne-causing bacteria. And actually, the story about the acne-causing bacteria is also much more complicated than we thought previously, because we thought, okay, they are bacteria which we name Propionibacterium acnes because it causes acne. But actually, after it was found that, first of all, it is not even the Propionibacteria, it is another family of bacteria called Cutibacterium acnes, so cute. And also, it is not really causing an acne. It plays a part in the acne development, but actually it is properly beneficial bacteria living on the skin of healthy people because this bacteria has the antioxidant property and literally transform our sebum produced by our sebum glands to the antioxidant protection for our skin. The problem is when we have too much of sebum and the sebum is changed, it leads to the growing of the colony of these bacteria. And when there are too much of them, they become more aggressive. And also it promotes the growth of the specific types of these bacteria, which can be more inflammatory. Too much of bacteria, they start to communicate with each other. They start to produce some pro-inflammatory substances, and they find a new friends, yeast, called Malassezia, on the skin surface. And with these new friends, they form the new, very resistant colony called biofilms on the skin surface. Also, they go downstairs in the sebum glands, creating this inflammatory colony right there. And this bacterial and yeast activity stimulate cells in sebum glands, surprise, to produce even more the sebum and even worse quantity of this sebum because these bacteria in yeast, they just love it. It's their favorite junk food. So they are interested in the hyperproduction of these substances. But also this bacterial and yeast activity leads to the protective reaction of skin cells. So they start to produce more of specific protein called keratin. And this keratin creates this clogged pores because it's like to create, the lid on the surface of this pore, closing this pore, trying to hide everything inside it. And all this complicated process, which takes about 8 weeks, results in skin redness, skin inflammation, and formation of this not so pleasant to see element, which we call acne or pimple, or speaking on the dermatological language, it will be papule or pustules. And there are a lot of different kind of biologically active substances involved in this process. We call it cascade or biochemical waterfall of transformation in the skin. So, as you can understand, everything is important here. Too much of hormones or higher sensitivity to the male hormones provokes this hyperproduction of sebum in sebum glands. When sebum glands are overactive, it provokes the overgrowth of bacteria. Bacteria find yeast. they're coming back to the sebum glands, provokes even more of inflammation, change the whole landscape around them, and create this acne element, which we should treat more globally, because our traditional approach to the acne treatment was very much focused on the block of the sebum production. So we tried to interact with these poor sebum glands, trying to make her produce less of sebum, because no sebum, no problem. Okay, if the bacteria, they don't have enough food, they cannot overgrow. And it works, but it doesn't work in 100% of cases. And the most important, when you block the sebum production, and you cannot do it eternally because your skin needs a protection. When your skin becomes dry, it is very uncomfortable, and also it leads to the skin inflammation again, because it just crush and destroy your skin barrier, and your skin is open to all external damage. When you overuse this mattifying, sebum-regulating skincare and ingredients, you have the skin irritation, inflammation, dryness, a lot of discomfort, and another infection. It can be not infection, typically caused by the acne-causing bacteria, but as a patient, probably you don't feel the real difference because your skin is still inflamed. So what's the point? And also, when you stop to block the sebum production, everything is coming back. And you have your acne again, because once again, your sebum glands produce sebum, and your sebum is the perfect food for all these unfriendly bacteria and yeast. So now the new approach to the acne treatment, it's focused not only on the sebum glands, it's also focused on a more complicated mechanism, because now we understand better how it works. So we can use different ingredients which can interact not only with the sebum glands, but also with the microbiome. Ingredients which can change not only the quantity of the sebum produced in the gland, but also the quality of the sebum. And if you make it more antioxidant, more anti-inflammatory, it also helps to resolve the problem. But most importantly, we can use special substances which can discipline bacteria, which can slow down and suppress the growth of these acne-causing bacteria and acne-causing yeast on your skin, and promote the growth of beneficial bacteria, which can help your sebum glands to produce less of sebum naturally. So it's absolutely new approach to this treatment. Now we use different substances, and it feels much gentler. It works more efficiently for the skin. So we still want to reduce the sebum production, and we still can do it with a lot of different kinds of skincare ingredients. And first line in all international cosmetic guidelines, it is still retinol and retinol derivative. Retinol, or vitamin A, it is a very efficient ingredient which is able to interact with sebum glands directly, and which is able to suppress the sebum production. And in the same time, what is good about retinol, it naturally speeds up the skin renewal. When you have faster skin renewal, you have less of this protein called keratin. As you remember, then we have too much of it, because our bacteria and yeast, they triggers the hyperproduction of this keratin, closing pores and closing follicles. So you have less of keratin, you have less of sebum, so you have less of landscapes for acne development. Why I don't use retinol myself in my formulations? Because it is not pregnancy safe. If the product, it's not safe enough for pregnant women or breastfeeding women, it is not safe for everyone, so it should not be used except for medical purposes. So for the mild form of acne and medium form of acne, I don't recommend to use retinol. We're using retinol alternative. There are a lot of them. For example, plant stem cells from maclura plant, or ingredient extracted from avocado, called avocutine. They act exactly like retinol interacting with sebum glands, reducing the sebum production up to 30% in the first 2 weeks of use, without drying the skin, without irritating the skin, and being perfectly safe for everyone, including pregnant women. But also, we use prebiotics. Prebiotics, they are beneficial food for our beneficial bacteria. It's if this transformed pathological sebum in acne, I prefer to call it junk food for bacteria, which promotes the growth of unwanted bacteria on the skin. We give the healthy food to them. So like we're giving our bacteria healthy sweet and green salad and nice fish and a lot of water. And we have the growth of beneficial bacteria, which are anti-inflammatory, and we suppress the growth of acne-causing bacteria and yeast. So it stops this process of the pathological change of the microbiome alongside with the reduction of the sebum production. We are using biological peel to exfoliate the skin, to eliminate this keratin from the skin surface. And we use special skin barrier restoring ingredient, starting with a niacinamide, vitamin B3, which is anti-inflammatory and which promotes the synthesis and production of healthy lipids called ceramides, forming the perfect skin barrier. And we use different kinds of skin-identical substances which cover the skin barrier and restore it perfectly. So as a result, in the same time, like 8 weeks, maybe 12 weeks, maybe a little bit longer, you have no inflammation because inflammatory bacteria are suppressed. Your skin is cleared. You have much less of acne elements, and the sebum production in sebum glands is efficiently suppressed. Why it is so good? Because it acts much more globally. It helps to eliminate this inflammation from your skin without aggression. This global approach also helps to transform your skin for a long time. You can get these long-lasting results, so acne will not come back. What is also important in this approach to the acne treatment? The skin microbiome is very much related to your gut microbiome. Yes, they have what we call access, so everything what you eat is absorbed in your intestine and it's absorbed in your gut, and active substances from your food, they affect the skin as much, and they can be beneficial, they can be not so beneficial, they can be dangerous for your skin. It will be amazing if you can support your gut microbiome at the same time of the acne treatment, and there are specific probiotics recommended to take during the acne treatment with scientifically proven to be efficient, but also we recommend to change your diet, to eat more natural prebiotics in your diet. That will be raw vegetables, fruits, green salads. Also, it would be great to eat some fermented food, like fermented cabbage, like kimchi, to drink fermented beverage, like kombucha or kefir. They will be very beneficial for your skin health. And what is better to avoid in the first place? Please avoid sugar during the acne treatment, because high level of sugar, it is a well-known trigger of the inflammation, and it triggers only the hyperactive production of sebum and promotes the growth of acne-causing bacteria and yeast, because the sugar, it is a junk food for them. Also, it's better to avoid or minimize the intake of the red meat, because the red meat contains a specific amino acid called leucine, which can be used by your skin also for inflammatory purposes. And for the same reason, for most people, it is beneficial to minimize the uptake of the cow milk or cow milk products. Not for everyone, but it is wise just to minimize your milk dairy product in your diet when you're treating the acne. And all you need, gentle microbiome-friendly cleanser, the active serum, which is based on the retinol alternative. In Medder, we call this EUSEP serum, based on the ingredient extracted exactly from the avocado and macula stem cells, alongside with noni stem cells, breaking this unwanted friendship between yeast and bacteria. And also the moisturizer, which is able to reduce the sebum production deep in the skin, in the sebum glands. Why the moisturizer? Because moisturizer is oil-based and it's easily penetrate into the sebum glands. It's very difficult to make it possible with the water-soluble ingredients. So sebum-reducing moisturizer enriched with prebiotics and probiotics to restore your healthy microbiome. A retinol alternative active serum for direct interaction with your acne-prone sebum glands. And the gentle prebiotic cleanser, it's your minimal program. And healthy lifestyle, healthier diet, and a little bit of positivity in your life, because you remember endorphins, happiness hormones. It is a real treatment for your acne. And I know how difficult it is to feel happy when you suffer from acne, but you should know it is not untreatable skin condition. We can treat it, especially with this innovative approach, without aggression. We can treat it successfully, and we can transform your skin. We can restore your skin health. Thank you for joining us today on the Medder Beauty podcast. If you found this helpful, be sure to subscribe so you never miss an expert skincare tip. Have a question or topic you'd like for me to cover? Send me a message at podcast@medderbeauty.com. And let's keep the conversation going. Also, you can visit medderbeauty.com and discover Medder Skincare, which I created. And if you enjoyed the show, I'd love if you left a review. It helps others find the podcast and keeps us growing. Until next time, stay healthy, stay glowing, and take care of your skin.